with Wellworth, Gerhard Wellworth, RN on January 7, 2019, written by Catherine Watson. Okay, fluid around the heart causes, heart and lung, symptoms, diagnosis, treatment, summary, overview. A layers of a thin sac-like structure called the pericardium surrounds your heart and protects its function. When the pericardium becomes injured or affected by infection or disease, fluid can build up between its delicate layers. This condition is called pericardial effusion. Fluid around the heart puts a strain on this organ's ability to pump blood efficiently. The condition can have serious complications including death if it isn't treated. Here we'll cover the causes, symptoms, and treatments for fluid buildup around your heart. Serious medical condition. Your best chance at successfully treating fluid around the heart is getting an early diagnosis. Speak to a doctor if you're concerned that you may have pericardial effusion. What causes fluid around the heart? The causes of fluid around your heart can vary widely. Pericarditis. The condition refers to inflammation of the pericardium, the thin sac that surrounds your heart. It often occurs after you've had a respiratory infection. The American Heart Association points out that men between the age of 20 and 50 years old are the most likely to experience pericarditis. There are several different types of pericarditis: bacterial pericarditis, Staphylococcus, pneumococcus, Streptococcus, and other kinds of bacteria can enter the fluid that surrounds the pericardium and cause bacterial pericarditis. Viral pericarditis can be a complication of a viral infection in your body. Gastrointestinal viruses and HIV can cause this kind of pericarditis. Idiopathic pericarditis. Idiopathic pericarditis refers to pericarditis with no cause that doctors can determine. Congestive heart failure. Nearly 5 million Americans live with congestive heart failure. This condition occurs when your heart isn't pumping blood efficiently. It can lead to fluid around your heart and other complications. Injury or trauma. An injury or trauma can puncture the pericardium or injure your heart itself, causing fluid to build up around your heart. Cancer or cancer treatment. Certain cancers can cause a pericardial effusion. Lung cancer, breast cancer, melanoma, and lymphoma can cause fluid to build up around your heart. In some cases, the chemotherapy drugs doxorubicin, adriamycin, and cyclophosphamide cytoxan can cause a pericardial effusion. This complication is rare. Heart attack. A heart attack can lead to your pericardium being inflamed. This inflammation can cause fluid around your heart. Kidney failure. Kidney failure with uremia can lead to your heart having trouble pumping blood. For some people, this results in pericardial effusion. Fluid around heart and lungs. Fluid around your lungs is called a pleural effusion. There are some conditions that can lead to fluid around your heart and your lungs as well. These include congestive heart failure, a chest cold or pneumonia, organ failure, trauma, or injury. Fluid around the heart symptoms. You may have fluid around your heart and not have any signs or symptoms. If you are able to notice symptoms, they may include chest pain, a feeling of fullness in your chest, discomfort when you lie down, shortness of breath, a difficulty breathing. Diagnosing fluid around the heart. If a doctor suspects that you have fluid around your heart, you will be tested before you receive a diagnosis. Tests you might need to diagnose this condition include chest x-ray, echocardiogram, electrocardiogram. If doctor diagnose fluid around your heart, they may need to remove some of the fluid to test it for infection or cancer. Treating fluid around the heart will depend on the underlying cause as well as your age and your general health. If your symptoms if your symptoms aren't severe and you're in stable condition, you may be given antibiotics to treat an infection, aspirin, bufferin to numb discomfort, or both. If the fluid around your lungs is related to inflammation, you may also be given non-steroidal anti-inflammatory drugs instead, like ibuprofen, Advil. If fluid around your heart continues to build up, the pericardium can put so much pressure on your heart that it becomes dangerous. In these cases, your doctor may recommend draining the fluid through a catheter inserted into your chest or open heart surgery to repair your pericardium and your heart. The takeaway: fluid around the heart has many causes. Some of these causes put your health at a higher risk than others. Once your doctor has determined you have this condition, they will help you make decisions about treatment, depending on your age, your symptoms, and your general health. You may be able to manage this condition with over-the-counter or prescription medication while you wait for the fluid to be absorbed into your body. In some cases, more drastic action like draining the fluid or open heart surgery become necessary. Your best chance at successfully treating this condition is getting an early diagnosis. Speak to a doctor if you're concerned that you have fluid around your heart. Okay? Fluid in the chest. Pleural effusion. Pleural effusion, also called water on the lungs, is an excessive buildup of fluid between your lungs and chest cavity. It can be caused by certain let's go this one first and go back to continue later for another congestive heart failure. Okay. Fluid in the chest, pleural effusion. Pleural effusion, medically reviewed by Judith Marcin, MD, on April 6, 2018, written by April Kahn and Anna Gutter. Okay. Causes, type, symptoms, diagnosis, treatment complication, cancer outcome. What is pleural effusion? Pleural effusion, also called water in the lungs. Okay, we did this already. Then thin membranes called pleura cover the outside of the lungs and the inside of the chest cavity. There is always a small amount of liquid within this lining to help lubricate the lungs as they expand within the chest during breathing. Certain medical conditions can cause a pleural effusion. Pleural effusion are common, with approximately 1 million cases diagnosed in the United States every year. According to the American Thoracic Society, it's a serious condition associated with an increased risk of death. In one study, 15% of hospitalized people diagnosed with pleural effusion died within 30 days. Oh no, please Lord, don't. Feeling down kay. Bata pa down sa mga po. Kung saan man yung tawag ng anak. Diyara ba yung makabukot? Puro lalaki. Remove the water in the heart of John. How does Pleural effusion develop. The flora creates too much fluid when it's irritated, inflamed, or infected. This fluid accumulates in the chest cavity outside the lungs, causing what's known as a pleural effusion. Certain types of cancer can cause pleural effusion, lung cancer in men and breast cancer in women, being the most common. Other causes of pleural effusion include congestive heart failure, the most common cause overall, cirrhosis or poor liver function, pulmonary embolism, which is caused by a blood clot and is a blockage in the lung arteries, complication from open heart surgery, pneumonia, severe kidney disease, autoimmune disease such as lupus and rheumatoid arthritis. Types of pleural effusion. There are several types of pleural effusion, each with different causes and treatment options. The first classification of pleural effusion is either transudative or exudative. Transudative pleural effusion. This type is caused by fluid leaking into the pleural space as a result of either a low blood protein count or increased pressure in the blood vessel. Its most common cause is congestive heart failure. Exudative effusion. This type is caused by black lymph or blood vessel inflammation, tumors, lung injury. Common conditions that could result in this type of pleural infusion include pulmonary embolism, pneumonia, and fungal infection. Complicated and uncomplicated pleural effusion. There are also complicated and uncomplicated pleural effusions. Uncomplicated pleural effusions contain fluid without signs of infections or inflammation. They're much less likely to cause permanent lung problems. Complicated pleural effusion, however, contain fluid with significant infection or inflammation. They require prompt treatment that frequently includes chest drainage. Symptoms and signs of pleural effusion. Some people show no symptoms of pleural effusion. These people usually find out they have the condition through chest x-rays or physical examination done for another reason. Common symptoms of pleural effusion include chest pain, dry cough, fever, difficulty breathing when lying down, shortness of breath, difficulty taking deep breaths, persistent hiccups, difficulty with physical activity. See your doctor immediately if you have symptoms of pleural effusion. Diagnosing pleural effusion. Your doctor will perform a physical examination and listen to your lungs with a stethoscope. They may also order a chest x-ray to help diagnose pleural effusion. Other possible tests include CT scan, chest ultrasound, pleural fluid analysis, bronchoscopy, pleural biopsy. In a pleural fluid analysis, your doctor will remove fluid from the pleural membrane area by inserting a needle into the chest cavity and suctioning the fluid into a syringe. The procedure is called a thoracentesis. This also works as a common procedure to drain the excess fluid from the chest cavity. The fluid will then be tested to determine the cause. Your doctor may also choose to perform a pleural biopsy, which involves taking a sample of tissue from the pleura. This can be done by inserting a small needle from outside the chest wall into the chest cavity. If they discover you have a pleural effusion but they are unable to diagnose which type, your doctor may schedule a thoras, thoracos, thoracoscopy. This is a surgical procedure that lets the doctor see inside the chest cavity using a fiber optic camera. For this procedure, your doctor will make a few small incisions in the chest area while you're under general anesthesia. Then they'll insert the camera through one incision and the surgical tool through the other to extract a small amount of fluid or tissue for analysis. See that? They're going to insert that into your body. Top doctor begs American to stop. Treating pleural effusion. The underlying cause of the condition and the severity of the effusion will determine treatment. Draining fluid. Generally, treatment involves draining the fluids from the chest cavity either with a needle or a small tube inserted into the chest. You will receive a local anesthetic treatment. More comfortable, you may feel some pain. You may feel some pain or discomfort at the incision site after the anesthetic wears off. Most doctors will prescribe medication to help relieve the pain. You may need this treatment more than once if fluid builds up again. Other treatments may be necessary to manage fluid buildup. If cancer is the cause of the pleural effusion, fluoridesis. Fluoridesis is a treatment that creates mild inflammation between the lungs and chest cavity. Flora after drawing the excess fluid of the chest cavity. A doctor injects a drug into the area. The drug is often a talc mixture. This medication causes the two layers of the flora to stick together, which prevents the future buildup of fluid between them. Surgery in more serious cases, a doctor surgical insert a shunt or small tube into the chest cavity. This helps redirect the fluid from the chest into the abdomen when it can be more easily removed by the body. This may be an option for those who don't respond to other treatments. Pleurectomy, in which part of the pleural lining is surgically removed, may also be an option in certain cases. Rest of pleural effusion treatment. Treatment of some cases of pleural effusion may be managed with medication and other supportive care. Most people recover within a few days or weeks. Minor complications from more invasive treatments can include slight pain and discomfort, which often go away with time. Some cases of pleural effusion can have more serious complications depending on the severity of the condition, cause, and treatment used. Serious complications can include pulmonary edema or fluid in the lungs, which can result from draining fluid too quickly during thoracentesis. Partial collapse lungs infection or bleeding. Those complications, while serious, are very rare. Your doctor will help determine the most effective treatment option and discuss the benefits and risks of each procedure. Pleural effusion and cancer can be result of Pleural effusion can be the result of cancer cells spreading to the pleura. They can also be the result of cancer cells blocking the flow of normal fluid within the flora. Fluid may also build up as a result of certain cancer treatments such as radiation therapy or chemotherapy. Certain cancers are more likely to cause pleural effusion than others, including lung cancer, breast cancer, ovarian cancer, leukemia, melanoma, cervical cancer, uterine cancer. Signs and symptoms often include shortness of breath, cough, chest pain, and weight loss. Fluoridesis is often used as a treatment for the malignant pleural effusions caused by cancer. Your doctor may prescribe antibiotics if you have or are susceptible to an infection. Steroids or other anti-inflammatory medications may reduce pain and inflammation. In addition to treating the pleural effusion, your doctor will treat the cancer that caused it. Pleural effusion are typically the result of metastatic cancer. People who are undergoing treatment for cancer may also have compromised immune system, making them more prone to infections or other complications. What is the outlook for a pleural effusion. Pleural effusion can be serious and life-threatening. Most require hospitalization treatment and some require surgery. The time it takes to recover from pleural effusion depends on the cause, size, and severity of the effusion, as well as your overall health. You will begin your recovery in the hospital, where you will receive the necessary medication and care to help you begin to recover. Many people report feeling tired and weak in the first week after they've been discharged from the hospital. On average, you will see your incision sites from surgery heal within 2 to 4 weeks. You will require continued care and follow-up once you're home. Okay, so that's how you have to do it. So let's go back and I show you and focus you the picture. So, floral incision. Wow. It seems like I have no signal because I didn't see any pictures at all. Okay, sorry guys. That's
Oops. It's just a training grenade. It's done.
Stand down, everybody.
I was used in a robbery last night, and, I know where. What do you say, Leon? Want to solve a murder together? For old time's sake?
ribs, floral space, floral effusion. Okay, so that's where, that's the
I have a
heart
friend who was there
and the
last night when the place got
lungs.
robbed.
That's the
Does this friend have
ribs,
a name?
He wants to remain
floral
anonymous. But I
effusion, a
suppose I have a
floral
minor thing from being called.
space.
I didn't let you into your whole time. And it's direct.
After prison, I went to work for a man named
And
Kobe
floral
Harper.
effusion.
Runs an illegal sports book. Angry guy. Call him behind his back because he never forgives a debt.
Thank you guys for watching. I hope you like my video. Don't forget to subscribe and hit the notification button to keep you posted. Make sure to like and share my video. I love you guys. God bless you always. Thank you so much. God bless.